Good afternoon, everyone, and thank you for joining us. NCBA welcomes you to our webinar on Aging Well in Place, presented by Keisha Lewis of Weldom LLC. Ms. Lewis is a practicing occupational therapist and a certified diabetes care and education specialist with more than 17 years of experience working in the fields of human services, mental health, and physical disability. She serves as a consultant with the Health and Wellness Program here at NCBA. In 2019, Keisha co-founded Weldom LLC, an aging in place consultancy. Keisha's ultimate focus is empowering individuals with the skills they need to be independent in their environment without fear. And thank you for joining us again, Keisha. We so welcome you. We appreciate you. And thank you. The floor is all yours.
Okay, so thank you everyone for joining today. We're going to discuss aging well and aging in place and what that means. And so I'm going to start by telling you a little bit about Weldom. So Weldom, our mission is to bridge the gap in healthcare by empowering older adults and individuals with diabetes to be able to thrive in their home and community. And so I'm going to skip through some of that because you can see it on the slide. But I always tell people in our name, it says it all. You know, Weldom represents the ability to achieve wellness in your domain and your state of being. So being able to achieve wellness in your home. And that's my goal and my focus and what I want. So our goal for today's presentation is be able to define the term aging in place. What is aging in place? We're going to talk about that. We're going to discuss the challenges that older Black and African-American older adults face aging in place. We're going to discuss the benefits of aging in place. We're going to identify some key components involved in aging safely in place and how to identify hazards within your home. We're going to close with, I'm going to challenge you to make an action plan to start a conversation to help you age in place. And we're going to identify some available resources that are available to you. Oh, sorry. So what I was going to ask you, and it looks like I can't make my woman play here in the video, and that's okay. So I'm just going to ask you all to put in the chat right now. Just type in, and I'm going to read some of the comments. But what does aging well mean to you? I always tell people, for me, aging well means to be able to still walk and talk and have my mental faculties about me, to be able to still laugh and have a good time with friends and family, and travel. So really to be independent, that's what aging well to me means. But take a minute and throw some stuff in the chat and let me see if I can see what you all think. But tell me, what does aging well mean to you? If you can type in the chat so I can see some stuff here. Can you all type in the chat there? Okay, I see I can stay at home, be healthy, and do my thing. Anyone else got a thought? Let's see. Come on, type away. What does aging well mean to you? I want to hear from you. Aging well means to have the physical and mental ability with good relations, peace and money. Okay, anyone else have any thoughts about aging well? All right, well, I don't see anybody else, but guys, I hope you think about it. And if you hadn't thought about it, I want you to think about it today because I don't see any more comments in the chat. So we want to keep the thought going. And as I'm continuing to present, if you just couldn't figure out the chat, I want you to go back and I want you to type in there what aging well means to you. So I'm going to give you a little bit of facts about aging, okay? So let's start there. So approximately 78% of adults in the United States over the age of 55 have at least one chronic condition such as diabetes, cardiovascular disease, chronic obstructive pulmonary disease, arthritis, or cancer. Okay, so keep that in mind. But 75% of adults want to age at home. So having these chronic conditions, but you have the desire to want to age at home, I want you to remember and think about that. And when it comes to minority Medicare beneficiaries that report difficulties with performing everyday tasks at home, which we call activities of daily living, such as personal skills related to bathing, dressing, performing hygiene, eating, Medicare did a survey and a study, and they found that 19% of Black beneficiaries reported difficulty with 2 or more ADLs. 21% of Latino beneficiaries reported the same, and 14% of white beneficiaries reported difficulty. So having a chronic condition ultimately can lead to disability, and particularly among minority older adults. So we have to consider that when we think, hey, we have the desire and we want to age at home in place, but these are some facts, okay? So adults from racial and ethnic minority backgrounds are at a greater risk for disability. So some of these differences make it a little bit of a challenge for us to age at home and in place. Some other aging facts that I just want to talk about here is it's estimated that 1/3 of the US population, so 109 million individuals, are adults between the ages of 50 and 80, okay? And nearly 27 million people belong to racial and ethnic minoritized groups. 49% of all older adults reside in communities where there are fewer housing units and commercial properties in the area. And we find this generally in suburbs and in rural areas. And over 16% of adults over the age of 55 are childless. So that's another factor to consider in aging in place. And I'm one of those people. I fall into that category. I'm not quite over 55, but I'm childless. A 2020 article in the American Society of Aging's Generation Journal stated within 20 years, 50 million households in the United States will be headed by an individual over the age of 65. And the number of households headed by persons over the age of 80 will more than double to reach an unprecedented 18 million. So as we age as society, it's going to be many of us in the coming years that are living perhaps alone, and we're going to be older. So I have to ask the question, are we prepared to age in place? And I'm asking you, are you prepared to age in place? So now we're going to talk about aging while Black in America. So I want to definitely be able to talk about aging in place, and I want it to sound like a great conversation as I started doing this presentation, and the health and wellness group asked me to talk about this. But I can't ignore that aging while Black in America, it looks different. So healthy aging, it involves your physical environment, your education, your ability to access services, community relationships, and so much more components. But numerous studies have noted that Black Americans, we have worse health than their white counterparts, including chronic diseases and disabilities that often lead to shorter and sicker lives than white Americans. And then historically, Black and African American older adults, we experience health disparities. Health services have been limited to us, access to resources have been limited to us, and it ultimately affects the ability for how older Black adults age in place. Also, if we look at socioeconomic disadvantages, again, those things that I mentioned, the access to healthcare, financial constraints, poor housing, our environmental factors, as well as community resources and poor health. Those are all things that ultimately impact our ability to age in place and be successful. So I've thrown this term out a lot. I keep talking about aging in place, aging in place. So what actually does aging in place mean? So aging in place refers to older adults being able to stay in their environment. So their own environment might mean their home, it could mean an assisted living or independent living resident, or it could be simply just staying in their community. You may have to move in another location, but you're still in your community. Aging in place means that you have everything you need to be safe in your home, and you're able to live independently, comfortably, and safely in your own community as you age. It involves making adaptations to your home environment sometimes, while being able to access support services and resources is needed to maintain a high quality of life. And what research has shown is that individuals who can actually age in place, age in their own environment, they have positive physical benefits and psychological benefits. So this was interesting while I was preparing for this presentation. I found this in January and February of 2022, the University of Michigan did this national poll on healthy aging. And they asked a national sample of adults between the ages of 50 and 80 about their perspectives on aging in place, their homes and resources. And I know it's a little bit small, but one thing I wanted to highlight on the left there is it says 88% people believe it's important to age in place. So I would agree. But then down there that's smaller, and I have the link here for the study if you want to look at it, but it's smaller and you can't see it as much down there, the yellow bars. But it says considerations given to modifications needed to remain at home. So how many people have given considerations to modifications to help them age? So a lot is only 15%. Some is 38%. A little is 20, I think it's 26%, and none is 21%. So some people have given it a thought, but when you look at that, not very many of us have thought about what it looks like to, or what it takes to age at home in place. And then that other little chart on the right side there, it says the respondents also reported if they had disability, impairment, or chronic health conditions. And so you can see there based on age group, some, if you were between the ages, I'm going to take 65 and 80, 42% said yes, definitely, they had some disability. 45% said no. And then it goes through each category of their asking them to assess their physical health, their mental health, and then their disability. So those are some of the things that I think is really important that you consider as you make the decision and you have the desire to be able to age in place at home. So some of the benefits of aging in place. When compared to living in an institutional setting, older adults that live at home have significantly improved independence, quality of life, social connectiveness to their friends and their families, reduce health savings, or reduce, healthcare complaints and cost savings. So as your ability changes over the years, your home should be able to provide you and your loved ones with the support you need to be able to do the everyday daily activities that you want to do and that you need to do. And I can say, I'll use my grandmother as an example. She was able to age in her home in place. She was able to live in her home until she was 99 years old. And even though her health declined, we were still able to care for her in her home, but there was resources that we had to put in place to do that and to do it effectively. So now we're going to take a look at examining what we need to be able to age in place. So are we prepared to age in place? What are the available resources that are going to support me? Do you have long-term care insurance? What about your community supports? Do you live in an urban area or a rural area? That's going to impact the services you have. Will you be able to drive or access transportation? And then I want you to think about, how is my memory? Do I have friends and family or faith community that I can rely on for support? And then how are my personal finances? So these are things that I want you to consider as I go through the next slide and we talk about what it really takes to age in place. So when we look at aging in place, I like this little model here, but individuals that typically are successful in aging in place, they have higher functioning, they're able to complete their activities of daily living, so their self-care needs. They don't have cognitive deficits such as dementia, and they're able to utilize their community resources. So we're going to take a look at the physical ability, the social emotional needs, and the environmental factors that it takes to be able to age in place. So we're going to look at physical first. So with your physical ability, strength and balance impact your ability and your strength and your balance and your ability to have good mobility. So when we look at strength, your muscle growth peaks at the age of 30, and we lose 3 to 5% of muscle mass each decade after that. So the rate of loss typically increases after age 75, but it can occur as fast as age 65. Okay, so we need strength to be able to stand, to walk. And then we have balance. So balance relies on your sensory, your motor, your vestibular, so that inner ear connection, and your visual system. So your brain has to put all of those things together, and that information is needed to be able to maintain your balance. Okay. But a lot of older adults, they remain inactive at times, and older adults, the inactivity can increase with age. So the percentage of older adults being active, as that decreases, their ability to have good strength and balance also decreases. But I want you to remember that a little goes a long way. So I want you to consider, especially if you don't exercise now, it's never too late. And just a little bit of exercise will increase your physical ability. It can improve your strength. It can improve your balance. And the other thing, when our strength is impaired and our balance is impaired, then that leads to falls. And so I'm going to talk briefly just a little bit about falls and aging, but that could be a whole nother seminar. So with falls and aging, I ask you, have you ever taken a falls risk assessment, or do you know your risk for falling? If you haven't, there's some great resources at the National Council of Aging that has a falls-free checkup. But I encourage you to know your risk. So according to the Center of Disease Control, more than 1 in 4 adults over the age of 65 fall each year. Falling one time doubles your risk for falling again. And then the fall death rate increased by 30% from 2007 to 2016. So that's showing us that falls are increasing. And at that rate, by 2030, research showed us that we will see 7 deaths per hour from a fall. And so having the ability to increase your strength and increase your balance can really decrease your risk for falling. So if you have deficits, if you've identified that you're a fall risk, being able to talk to your doctor about things you can do. And I'm going to talk about things you can do in a few slides. So again, with your physical ability, if your physical ability declines, low muscle mass, low strength, decreased gait speed, which is your walking speed, they all been associated with impaired ability to be able to perform your self-care tasks, to be able to have mobility, so walking, moving, standing, transferring. So the decreased ability to perform these tasks often are caused by decreased balance, decreased cognition, decreased strength, and decreased mobility. So physical ability is a really important aspect to age in place. So things you can do for your physical ability or to improve your physical ability. One, you can work with a physical therapist or an occupational therapist. So physical and occupational therapists, they can help address your balance, your muscle strength, your endurance, your mobility needs, and your self-care needs. So if you feel like that's needed and those things have decreased, talk to your family physician about it. The other thing is you can find a community-based program that works on balance. And so I listed 2 here, the Stay Active and Independent for Life. It's for adults 65 and older. It's a community-based program for balance. The Matter of Balance is for adults 60 and older. And again, these are 2 community-based programs that can help enhance your physical ability and your balance, and work on fall prevention as well. The other thing you can do for your physical ability is have a well-balanced diet. So eat well. A diet low in protein, high in whole grains, vitamin D, calcium, and limited alcohol can really help your physical ability. And then the other thing you can do is do yearly vision checks to make sure you can see well, because that impacts your mobility. The next aspect is going to be your social emotional needs. And so what is social emotional needs? I'm going to break it down to the social and then into the emotional. So your social supports include your networks. So whether that be your family, your friends, your church, your neighbors. If you're in a residential environment, it could be your care coordinators, your residential service providers. And then you have paid services, physicians, nurses, therapists, community health workers. Those are all part of your social support. Your social support provides emotional, material, and informational support. And so when we go into what does that emotional support encompass, it encompasses things for your health and well-being. Emotional support is an expression of understanding, encouragement of feelings, advice, and information or guidance. So when you have good emotional support, you often experience improved health, psychological, and social and emotional well-being. And this can also help reduce symptoms of depression, which we're going to talk about a little bit more as we age. So with depression and aging, some estimates of major depression in older adults usually come from people living in the community, range from less than 1% to about 5%, okay? But it can rise up to 11%, it can rise up to 13% for those who require home health care and 11% for those who are hospitalized. So I read that first part and I'm going to read it again. So it says some estimates of major depression in older people living in the community range from less than 1% to about 5%. So I stated that because I want you to know that depression is really not a normal part of aging. Depression is something that's treatable. It's a treatable medical condition, and it's not a normal part of aging. However, most older adults that have more illness and physical decline, they typically feel a little bit sad because things are going on, okay? But what we found is that older adults are typically more satisfied with their lives than younger people, okay? So it might have a little bit of decline, but they're typically more satisfied. But what we do see is older adults that have more physical illness, that have more chronic conditions, that are in the hospital more, they're more likely to have depression, okay? Also, if an older adult had depression when they were younger, they're more likely to experience depression as they get older. But the most important thing on this slide is that depression is treatable. So if you're in that percentage that experience it, talk to your doctor about it because there is something that can be done. So some of the risk factors of depression, medical conditions such as stroke or cancer, genes, people who have a family history of depression, they may be at a higher risk for experiencing depression in an older age. Stress, including caregiver stress, sleep problems, loneliness, social isolation, lack of exercise or physical activity, physical decline that makes performing your activities of daily living difficulty, addiction and alcoholism, including substance-induced depressive disorder. These are all risk factors for depression, okay? And then some of the signs of depression. So how do you know, is someone experiencing depression? Are they continually feeling sad, anxious? Are they feeling hopeless, guilty, helpless, worthless? Are they irritable, restless, or having trouble sitting still? Have they lost interest in their activities or hobbies? Have they lost energy? Are they fatigued all the time? Are they moving or talking more slowly? Do they have difficulty concentrating or remembering or making decisions? Are they oversleeping or have difficulty sleeping? Are they eating more or less than usual? Is there unplanned weight gain or loss? Have they experienced thoughts, I mentioned to you, thoughts of death or suicide attempts? These are all signs of depression. So if you've heard someone say something, if you see something, then what I want you to do is you say something, you speak to them and say, hey, I think you may need to talk to your doctor. So how do you prevent depression as we age? Physical activity. We want to increase our physical activity. We want to keep ourselves moving. Again, a healthy, balanced diet, ensuring that we're getting enough sleep at night, between 7 and 9 hours of sleep. Maintaining your social connectiveness with friends and family. Do the things you enjoy. Participate in pleasurable activities, and then tell someone if you experience symptoms of depression. So on this slide, and Ms. Telesford, I think she'll put some of these resources that I keep showing you in the chat. So check the chat. But these are just resources for your social emotional needs. So MindWise Innovations, it's through a sound, it's an app, you can go on the internet and you can download it, but it helps you to be calm and relaxing your mind. Talking to your family physician about what your needs are and how you're feeling. Local area agencies on aging, so whatever region or area you're in. Check those agencies out and say, hey, I'm feeling this way. What are some resources? The American Psychological Association, they have this great topic on aging and older adults. The Geriatric Mental Health Foundation is another resource. And so take advantage of some of these resources. So if you're concerned about yourself or someone that you love, out of all these things that we've discussed, then take a few minutes and visit some of these resources and do some of the self-assessment so they can help you identify, are you experiencing some depression? And then other resources for depression, the National Institute on Aging has depression in older adults resource. And then the CDC has a PEARLS toolkit. And this actually is a program to encourage, it stands for a program to encourage active, rewarding lives. And so again, physical activity, moving, social connectiveness, this is all very important. So I would encourage you to check out some of those resources. Now, the last part that I'm going to talk about is the environmental part. So in that big bubble I had earlier, we had the physical, the social, emotional, and now we're going to talk about the environment. So with environmental challenges, the first one there is older homes. So think about how many of you live in an older home? Older homes, what I often find is that older adults with middle to low income often like the resources to be able to modify their homes. And so later we'll talk about and highlight some programs that might be in your area that can help you with that. But older homes is a challenge. Are they safe? And we'll talk about that a little bit more when we talk about accessibility. The other thing that's an environmental challenge in Black and African American communities is gentrification in urban areas. So a lot of times that might force seniors to move due to higher taxes that they can't pay, the cost of living increases, access to transportation becomes more difficult. And so we see that in our senior community. And then with the access to transportation, this is critical to supporting aging and aging in place, okay? So in urban areas, if you're using public transportation, you have to consider, okay, is it accessible? If I have mobility issues, if I'm in a wheelchair, if I'm using a cane or a walker, can I get to that bus stop? Okay, is it safe for me? Do I feel safe? And in rural communities, we also have to consider accessibility to transportation. If you're no longer able to drive, we have to consider, okay, can we navigate planning and coordinating transportation needs? What if I call and the transportation cancels on me? How am I supposed to get to my appointment, or how am I supposed to get to my procedure? Those are all challenges that we face. Okay, so sometimes when transportation cancels, you miss a vital important appointment that you have. So we need to have another plan. And then again, with neighborhood safety, As you begin to age and you're aging in place, is it safe for you? How is the crime? How is the lighting? Am I going to be able to walk safely to the bus stop that's on the corner? Am I going to be able to catch that Uber or that taxi and feel safe? So those are all environmental challenges that can occur. So then we look at pitfalls in the home, because our home, remember, older homes, there's challenges, things we haven't fixed, things we can't fix. So every second of every day, an older adult suffers a fall. Okay, that's a lot of people. And so when we look at it, more than 1/5 of households that have older adults, 65 and older, have at least one member with a mobility challenge, mobility difficulty, including difficulty walking or climbing stairs. Okay, so sometimes that's why falls do occur in the home. We have challenges, physical challenges. Another interesting fact that I found while I was preparing for the presentation was that in the United States, it's estimated that only 3.5% of homes have basic accessibility features, including no step entry into the main part of the house, or an option to even have single living. So think about many of you who are in urban areas that have multiple story homes. And you don't have a bedroom on the first level. Okay. You don't have wide doors because your house was built in 1930 or 1940. So you would have challenges using a walker or wheelchair in your house. Single family houses, which are usually, the type of dwelling that most older adults live in, they're among the least accessible homes. That was also interesting to me. And so think about your home. If it's a single dwelling home and it's all on one level, think about, the steps to get in and out of the house. Is there a rail there? Think about, the bathroom. Is it accessible if I had to use a walker or a wheelchair? Think about, the doors. Are they wide enough if I had to go through them with a walker or a wheelchair? And then in the home, falls most likely occur, 55% occur inside the house, 23% occur near the house. So I think of the grocery store, the pharmacy, the parking lot at the grocery store. 22% occur away from the home. Maybe you're at the doctor's office. You could be in the community at church. You could be at a program in a senior community, and you, let's say a community center, and you have a fall. And so those are where falls occur. But what you see is most falls occur inside the home. Now, this is a resource that you can also use, and it's Check for Safety. It's the home fall prevention checklist for older adults. But what it does is it's a checklist for you to go through, for you to find hazards that are in your home. So if you've never thought about what are some of the hazards, what are some of the fall risk in your home, you can go through and you can look at this. This actually is on the CDC's website, and Ms. Telesford, I realized I didn't put a link for this one. But if you go and you check CDC and go to Check for Safety, the home fall prevention checklist, you can find this little brochure. So I would encourage you to take the opportunity, visit the website, and answer some of these questions to see, do you have hazards at home? So as we consider other considerations for staying at home and things I want you to ask yourselves, and this is I'm getting to my call to action for you all to be able to do, things that I want you to answer. Ask yourself, can you get in and out of your home easily and safely? Can you easily go up and down stairs in your home if you have them? Are there rails on both sides of the stairs? Do you need help standing up from a seated position, from the couch, from the chair, from the toilet? Is there enough lighting in the hallways and other places in your home? Can you safely navigate the home during the night when it's dark? Are there rugs or other items that are on the floor that could cause a fall? Is there a need for supportive or safety features in the bathroom? Do you need a grab bar? Can you step over the tub or the base of the shower? Once you answer these questions, if you answered no to any of these questions, You may need to have a consult with someone that we call a certified aging in place specialist like myself, or you might need to work with an occupational therapist who can assess your home environment to see if it's safe for you. Now, other considerations for staying at home, I always like to ask people, is how is your ability to process information and remember? So I actually took the snapshot out of a resource, one of them that NCBA actually published, a publication on Black and Aging in America, where it shows the prevalence of cognitive impairment in African American, Hispanic, and white older adults. Okay. So if you look at it and you look at the age group, what you see is that African Americans, our cognitive impairment as we get older, it increases. So it's higher than the other groups that are listed there. So that's really important because cognitive and function, the way you think, the way you remember, it can impact whether you can live at home alone. So this subjective cognitive decline, I did a snapshot of this infographic from the CDC, but something that I wanted to just point out is what subjective cognitive decline is. So it's self-reported experience of worsening or more frequent confusion or memory loss. So some cognitive decline does occur as we age, but frequently forgetting how to perform routine tasks is not a normal part of aging. So if I forget how to, use my stove, if I forget how to get dressed, that's not normal. That's not a new normal routine part. Okay. Some people with cognitive decline may be unable to care for themselves or to perform those self-care skills, okay, such as meal preparation, managing their medical appointments, managing their finances. Those things are actually what we call instrumental activities of daily living, okay? So being able to manage things at home. But they're just as important as our ADLs, which are those self-care components, okay? Limitations in being able to do those things can also impact a person's ability to manage, their medication, which can cause problems with their health conditions. If I have diabetes or I have heart disease and I forget to take my medication, that's going to overall impact my health. So it's important to consider as we age, how is my thinking? How is my processing? And it's really important to get screened for these things at an early age. Talk to your doctor. Say, hey, can I get a memory screening? Can I get some type of assessment that helps me better understand how my cognitive function is? And especially if you desire to stay in your own home. In this infographic that I have here, it just talks about, there's several. If you go on the CDC's website, you can look at each state. They have an infographic for subjective cognitive decline, and you can see what those over the age of over the certain age, the deficits they have. You can do it for different ethnic and minority groups. So give it a try. But among African American adults, you see there says 1 in 10 African American adults over 45 and older are experiencing some type of subjective cognitive decline. Another thing I want to point out there, it says, let's see, 86% of people with subjective cognitive decline have at least one chronic condition. Only half of people with cognitive decline have discussed the symptoms with a healthcare provider. So it's something that we're not talking about. If it's over only half, then hey, we're not talking enough about it. If we have memory loss, let's talk about it. And it says 52% of people with cognitive decline need help with household tasks. So those are all, again, considerations. Can we stay at home? So next we're going to talk about, again, a part of the environment is home modifications. So what is a home modification? Okay. Home modification is a process of adapting your living space to improve its use, its safety, and its independence. This is done through assessment of your personal needs and providing recommendations for those needs. Recommendations might include changes and additions to your home environment. And sometimes home modifications are simple, sometimes they're more elaborate. It could be as simple as taking the clutter off your floor, improving lighting, removing rugs to help prevent falls, or it could be something major like a bathroom renovation because you want to move that tub out and you want to make it a flat entrance for you to get in a walk-in shower. So I always tell people, look at your home now while you don't have a problem and make the necessary changes. Okay. So if I know that I'm getting older and my knees hurt periodically and I have arthritis and I have a 2-story home, but I can still go up those stairs without any help, maybe I need to start thinking about, hey, you know what? Maybe it's the appropriate time for me to look at what it would cost for me to get a stair glide, something to help glide me up the steps. Because I don't have a problem now, so I don't want to get in a situation where a problem occurs and I can't get up my steps, okay? Or I can't advocate for myself. So tips working with a home modification contractor. If you do decide, hey, I want some changes, I want my home modified, I want you to be, when you're working with that contractor, be specific about what work is agreed upon and have a written agreement for the work. Only provide small down payments upfront and stagger the balance upon stages of completion of the job. Find someone who's certified, a certified agent in place specialist. This list can be found on the National Association of Home Builders website, but ask for references too. Don't just rely on people. Make sure they're licensed and bonded and insured. Make sure they get their proper permits and you know what they are. And then Rebuilding Together, which is later going to be on a resource, they specialize in home modification services for older adults that need financial assistance. I do recognize that Rebuilding Together is not in every location, every state, but there are organizations like that that might be able to help you. And that's why it's important to reach out to your local area agencies on aging. So we talked about the components of aging in place, the physical ability, the social emotional aspect, and the environment aspect. So remember, all of those things we need to consider when we talk about aging in place or when we consider that we want to age in place. Because I recognize I want you all to be able to age in your own environment, but I want you to be safe doing it. And sometimes we can't do it. As we conclude, because I'm about to wrap it up at time, I want you to keep in mind that these are some decisions that you all need to make to be able to age and age in place safely, okay? So I have to ask, and again, I'm sorry my little graphic is not working here, but I'm going to ask you, what is your reality? And I really want you to think about it. Everything that I've said, I really want you to think, is this something that can happen? So I'm going to talk about non-traditional thoughts to help you facilitate aging in place and what it might look like for you. So for many of us, aging in place may not refer to simply remaining in our present home, okay? But it means, hey, we want to avoid or delay a nursing home or similar placement. So what we might need to do is locate or find a better social support system or access to care, okay? So you think about the concept of maybe it's multi-generational housing. Okay, so maybe you're living with your grandchild, your child, your son, your daughter. Or is it communal living? Maybe we're living in a small community. Currently, right now, I live in the back of my best friend's yard in a cottage. So that's communal living. I have my own space, but she has her own space. But we're together. Then the tiny house concept. I see in certain areas there's villages of tiny houses. I think I read something recently where in Georgia, in the Atlanta area, there's a tiny house village for Black and African Americans. Maybe it's community or neighborhood villages. Some communities, I know in the Northern Virginia area, there's neighborhood villages. You kind of pay into it and people in your neighborhood look out for you. And in some areas, it's no payment. It's just a group of volunteers that look out for those that want to live at home and live alone. Or it could be a combination of those things. It could be maybe I'm staying at my house with some support of a family member during the week, but maybe on the weekends, I'm spending the weekend with a child. But leaving you with that, I want you to consider this, is that most adults will still likely need some long-term care services and support before they die. Approximately half will require paid support during their lifetime, despite the desire to remain in one's home. So I want you to leave this presentation today and start the conversation with those that are closest to you, your family, your friends, your children. Who are those people that you trust? And have a conversation to talk about what the future looks like for you, what aging in place looks like for you. I want you to reach out to your support system. So that village that you have, whether it be your family, your friends, or your church folk. And I want you to tell them what your wishes are. I want you to make your wishes known, okay? And then creating a strong support system, identify who that support system is for you and make them aware. And not only just making them aware, make something official. So that is another conversation for another day. But we need legal representation sometimes to make that happen. So our wishes are carried out, and we don't have a group of people going back and forth about who said what, and she said this or he said that. So make your wishes known. So talk to your family, your friends, your neighbors, and your faith community, but also think about what legal things need to occur. Okay. And the other thing is oftentimes when someone does have cognitive decline, an older adult does experience dementia, family caregivers for persons living with dementia, they often feel overwhelmed. They can feel confused and embarrassed at times, and they're afraid for their family members. You know, you want them to live at home and be able to be alone, but you know that they can't. So have that conversation now so your family is not, the family caregiver isn't feeling burdened with the decisions that they have to make. And so again, based on this information, the needs of our family caregivers as well as family as a whole should be taken into consideration when we evaluate our desire to be able to live at home. So some other community resources here, the Capable program. This is a community-based program. It was actually started, I think, by Johns Hopkins University. It stands for Community Aging in Place, Advancing Better Living for Elders. It's a direct home-based program where an occupational therapist and a nurse come into the home. They increase mobility and function in the community so older adults can stay in their home. And there's several capable programs throughout the United States. So you'd have to check for your area. And then there's Rebuilding Together. Again, that is an organization that's a nonprofit, and they have a goal of assisting affordable home ownership with repairs and modifications for neighbors in needs in community. And then again, your area agencies on aging, your community senior centers, your neighborhood villages, those are all great resources. And lastly, I'm going to end with who's presenting this program today. So the National Caucus and Center on Black Aging Incorporated, they have great resources on their website, the health and wellness program, the housing services. So then they have this great national resource, which was put out in 2021, Black and Aging in America. And so I would encourage you to go to visit their website and actually take a look at that document. And then there's many other diverse groups that we work with at NCBA, and we have resources on our website for them as well. So, hey, if you need to reach out to another organization or another agency, there are resources available to you. And then here are my references here. And so I'm going to look in the chat because I see the chat has like 23 different little comments here. And I want to see if it's comments or questions that someone has. But I also wanted to see if anybody took an opportunity to tell me what it means for aging well for them. So I'm scrolling because I still want to see, because y'all were quiet when I said, what does aging well look like? Let me see. Someone asked for a copy of the slides. Okay, I don't see you guys. You didn't tell me what aging well looks like. So I want you all to think about that, okay? Um, okay, well, I don't see anything else, but I realize it's kind of close to time, so I'm gonna stop sharing my screen here. And then I'm gonna take some of the questions that you all have. But again, I challenge you. I really want you to walk away from this conversation and I really want you to think, am I prepared to age in place? And for me, when I was doing this, I realized you do not have to be 65 and older to start having this conversation. This is a conversation that I need to start having now. And I'm going to start talking to people who are my age and younger about preparing for them to be able to age in place. Because whether we realize it or not, we are all aging every day. And this is important to be able to talk about this because we don't talk about it enough. So thank you so much. And I'm going to turn it back over to Angie and Ms. Tellisford from NCBA.
Thank you, Keisha. Oh my goodness, what an awesome presentation. And we have about 7 minutes to get to some of these wonderful questions. And if it's okay, I'd like to kick us off. You spoke to something called health disparities. What is that? And how does it impact African American people?
Oh, I was muted. So health disparities, those are when we look at the conditions, I say where we live, work, and play. So how live, work, and play, I say, we're not, kids, but still like having access to resources because of where we live. Maybe we're in a community where we don't have the best grocery stores. We're in a community where we don't feel safe. So that brings challenges to, our ability to, exercise outside, our ability to walk to that bus stop because we need transportation. So health disparities have a lot to do with because we are maybe from socioeconomic disadvantaged groups. We belong to minority groups. Sometimes we do not have the same access to services as others. And so we move from this thing of having the health disparities to we want equal health opportunities. So we move into health equity, which means, hey, we all have the same resources. We all have the same rights to be able to age in place and age safely and be healthy. So I hope I answered that, Angie.
You did, but I want to just flesh that out a little bit because many of us who are African American and others who may not be live in communities that are being gentrified, and we don't have the same services or neighbors. Our communities look different now. I mean, how do we even begin to age in place when things that were once familiar to us are gone?
Yeah, and so that is something that's hard and that's tough. And so I think even the area where I live now, I see that it looks a lot different than how I remember it. And so there's a lot of seniors that are in these urban areas. And so things have changed around them. There is apartment buildings, there's concrete, there's, city buses. And so things really look different. And so I think that's when you really have to reach out and rely on those community resources to see what's available to you in that area. I was recently at a location where there's all of these 7 areas and there's just one senior center and people funnel into that senior center or that community center. It's not a senior center for education on various topics. But I also think that's where people that are aging advocates, such as NCBA and other organizations, we have to advocate for older adults. And that's one of the reasons why earlier in the slides, I talked about Weldom and my mission. We have to have health professionals and organizations who make a stance and say, hey, I want to be a part of a community. I want to bring services to those in the community because they can't get to their appointments. So you bring mobile practices and mobile clinics and you bring education that's there in the community. And you can't forget about the people that are there So it takes some policy and advocating when we know the community is changing and we see gentrification happening. I think we have to be able to speak up for those seniors, and those seniors that are in the community come out and speak up for themselves to say, hey, if you're bringing all of this to this area, I need these services and I need them in my community.
Okay, thank you. And since we have 3 minutes, Keisha, for the questions that we don't get to, will you please answer those questions and then we will get the answer back to the person who asked them? Is that okay?
Yes, ma'am. If we copy the questions in the chat, we can do that.
Okay, so I'm going to ask this question just to build on what you just spoke to. How do couples, partners, plan to age in place together?
Well, you know what? I've seen that, and sometimes that's a challenge because it's two people, and maybe it's two people without kids, like I talked about earlier. 16% of us are childless over the age of 55. But sometimes it's a partnership, it's a team effort, and I see it every day. But it becomes a challenge when both of you are aging, and both of you have your own health issues or your own conditions. So generally what I see is you partner with each other. The one that can perform the best at the highest level will kind of take on the job or the activity of the other, and so you do the things in tandem. If I'm the one that can walk more, go outside and get the mail, then I'm going to do that, and maybe you're the one that can stand longer to do the cooking. You just partner together. But even though you are a couple and you have each other, even couples have to really focus on putting resources and things in place to age well, because you're both getting older. And so that's really important. And so if you both end up in similar situations, you still will not be able to take care of each other. So you need to have processes in place to help you all prepare, to help the couple prepare.
Okay, so we are exactly at 2 o'clock or 1:59. So I'm going to just end by saying and asking you, what should we do? What should we do after we get off this webinar? What do you want us to do?
When you all get off this webinar, I want you to assess your risk for falling. I want you to look at the safety of your home using some of that safety checklist information from the CDC. And then I want you to write down a plan. What do you need to do? Who do you need to talk to be able to prepare yourself to age successfully in place in your home, if that is your desire? So I guess first question is, do you want to age in place? Do you want to age in your environment? And then go from there with the rest of the things I suggested.
Okay, thank you. Thank you so much, Keisha. Thank you for such a wonderful presentation, very thoughtful. And to our audience, thank you again for joining us. And we will get this presentation out to those who requested it. We give you back your day. Have a good day.
Bye-bye.
Bye-bye.